So if you're going to see your GP about an allergy, what GPs absolutely love is when you've kept a symptom diary, because what this means is that you and the GP together can have a look at it and try and start to spot any patterns and identify what the allergens are, what's causing your allergy. The common thing amongst all allergies is that the best way to treat them, if it's possible, is to avoid the allergen as much as possible. So if you know what the thing is to avoid, then you can start to avoid it. I always say, remember, there are two experts in that room. Whilst the doctor is an expert in medicine, you're an expert in you. It's only you that knows the experience that you've had. So don't be afraid to share all of that information with the GP, because that's really helpful. Most allergies are diagnosed based on the history. So they'll ask you lots of questions. They might want to examine you if there's any signs to see at the moment. They want to listen to your chest if it's asthma, or examine your skin if you've got any rashes. They may be able to make the diagnosis there and then based on the history. Sometimes if somebody has something like a severe allergy, anaphylaxis, then it's important to be referred to a specialist. And sometimes there are tests that can help, not always, but sometimes. So examples would be, sometimes with food allergies, a blood test or a skin prick test can be helpful. Sometimes with skin allergies, something called a patch test, where they leave a batch of different potential allergens on the skin to see what happens. And then with asthma, respiratory tests like peak flow and spirometry. So whilst for many allergies there aren't any tests that are helpful, for some there are. There are many different types of treatments for many different types of allergies. So let's think about hay fever. You can take antihistamine tablets, you can use steroid nasal sprays, you can use eye drops, all of which are available from the pharmacy. You don't even really need to see a GP unless you have very severe symptoms or if those medicines aren't working. Asthma, it's usually inhalers. If you have allergies that affect the skin, then as well as avoiding the allergen, it may be emollient creams, sometimes steroid creams. If you have food allergies, then it's strictly avoiding the food that you're allergic to. I think the common thing amongst allergies is that if you are able to avoid the thing, the allergen that's causing the allergy, then that's an important thing to do, but it's not always possible. One of the most important things to remember is if you have an allergy and if you're suffering and if it's affecting your quality of life, please do go and see a doctor or a nurse, because there are lots of treatments, there are lots of things we can do. And remember, you're an expert too. You're the one who has been living with this thing. So share as much information as possible, keep a symptom diary, and with the correct treatment, sometimes you can eradicate symptoms altogether, but usually you can at least lessen symptoms.